I am Gautam Kumra, Chairman of McKinsey Asia, and you're listening to the Future of Asia podcast series. The Asian century has begun. The region is now the world's largest economy. As Asia's economies evolve further, the region has the potential to fuel and shape the next normal. In each episode, we are going to feature conversations with leaders from across the region to discuss what Asia's rise means for businesses across the globe. Join us.
Hello everyone, welcome to the McKinsey Future of Asia podcast. I'm Debbi and I will be your host for today. Now in this episode, we will be talking about the notion of spiritual health and why it's important and how various stakeholders such as employers can explore ways to help people find purpose and space in their lives. Now today we are joined by three McKinsey experts and partners, namely Jacqueline Brassey, Kana Enomoto, and Atsushi Sorita. Now before we begin, could each of you introduce yourselves to our audience? Perhaps Jackie, we can start with you.
Thank you so much. I'm very happy to be here. My name is Jackie Brassey. I'm one of the co-leaders at McKinsey Health Institute, co-leading healthy workforces and also leading research science institute-wide.
Thank you, Jackie. Atsushi?
Hello, I'm very glad to be here. I am Atsushi Sorita. I'm a partner in Tokyo office. I have been leading healthcare and public sector work in Japan.
And hi, I'm Kana Enomoto. I'm a partner in Washington, D.C. and also Director of Brain Health for McKinsey Health Institute. It's great to be here and talk to everyone today.
Welcome everyone to this podcast episode. Thank you for being here today. So let's jump right into it. I think when we think about holistic health, we often think of things like physical, mental, or even social health. Very rarely we include measures such as spiritual health. So maybe in the first instance, Jackie, maybe could you take us through what exactly is spiritual health?
Of course. And I must say, what exactly is spiritual health is actually not that easy to respond to because there are many different ways of looking at it. And it's still also a concept that's being defined and fine-tuned around the world. However, what we see is that there is a core in spiritual health. There's a core concept around purpose and meaning, having an experience of purpose and meaning. And when we talk about health, we actually primarily emphasize the functioning bit as well. So when we define it at McKinsey Health Institute in the last studies that we've done, we ask people whether they are able to integrate meaning and purpose in life, and also whether they actually feel a connection to something larger than themselves. And it can be a faith or a God, but it can also be something else. So whilst there is not one correct answer, this is how we looked at it. And you're right, it hasn't been given a lot of attention throughout research throughout the world, because if you look at the different aspects of holistic health, of which spiritual health is a part, the other parts are physical, social, and mental health. And we did a scan a couple of years ago and looked at research emphasis on the different types of health. And we see that it's much more prevalent to find research on physical health. In our case, 75% of the studies investigated health primarily in physical health space, where 12% looked at mental health and 6% at social health. And then there was only 1% that looked at spiritual health. So there is a little bit more and growing attention to this, but there is still a lot to learn.
And how do you think spiritual health kind of relates to these other dimensions of well-being that you've outlined? And why do you think that an institute such as McKinsey Health Institute considers this like a core component of holistic health?
Well, what we see, and there is increasing research that shows the link between experiencing spiritual health and holistic well-being. So we looked at it when we measured this. We have multiple studies where we ask questions from people and then we look at how questions are correlated. And so if we look at the different concepts of holistic health, physical health, mental health, social health, and spiritual health, we see that they're very highly correlated. So in other words, if one improves, that's related to an improvement of the other elements. And actually, that is also supported by research. I can mention two different studies. One of them that I recently read found a link between self-rating of health by patients and the mortality rate. And the difference was between people with higher versus lower mortality rates were those that reported having a higher sense of purpose in life, and that is related to spiritual health. Other studies, for example, have looked at a daily practice of bringing meaning and purpose in life and how it positively impacts people with social anxiety disorder. And it disproportionately impacts those with a social anxiety disorder compared to the control group. So there is a buffering effect and there is a relationship with different aspects of health.
I would add that in our own research, we've also seen a very clear relationship between people having positive spiritual health and then feeling that they also have positive mental health, social health, and physical health. So that among people who said they had good or very good spiritual health, about 2/3 of them also said they had good mental health, good social health, good physical health. Whereas among those who said they had poor or very poor spiritual health, there were less than 20% of them said they had good mental health. And maybe only a quarter of them said they had good social health or physical health. And so while we can't say that it's causality, we know that it seems that spiritual health is a really important part of the cluster of holistic health factors.
There seems to be somewhat of a correlation here, which is actually really interesting. And that seems to be a more general trend as well. So I think now that we've talked in more general terms, I do want to zoom in into a more regional perspective. And Atsushi, maybe that's something that you could answer as well. So what factors do you think influence the perceived importance of spiritual health in Asia in particular? And is there variance across Asian countries as well?
I think it's partly also influenced by the fact that the spiritual health definition is not a well understood or shared amongst different countries in Asia. Like, for example, when I think about Japanese language, there's actually no real direct translation of spiritual health. That's actually affecting how respondents of our survey answer the questions. In general, the Asian respondents in our survey reported they put more importance or emphasis on spiritual health in Asia compared to Western countries. But there is actually one exception. Japanese respondents said the importance of the spiritual health is lower. Like, for example, 80% in Indonesia report their spiritual health is very or extremely important to them. But on the other hand, just 45% of respondents in the UK and as well as also Japan said relatively similar percentage. So a notable difference is observed amongst Asian countries. I think there are a couple of reasons that I can see. One is, as I said, this definition of spiritual health in some languages are unclear. So that's number one. And second, in my interpretation, even Asian countries, some countries are more, in a sense, westernized. It can be perceived as a bit more materialistic as opposed to a spiritually oriented meaning in their life. So that's a bit more speculation, my interpretation, but that's number two. And number three, there is a way in which, in general, Japanese people respond to the survey in a very moderate manner, meaning they tend to choose the middle as opposed to extremely or very. So those three factors influence how the survey responses are varied, even amongst Asian countries.
It's so interesting that how we see variability between different countries, but do we also see this kind of difference in across key demographics or even between cultures? Do you see this difference in perception of spiritual health?
I think there probably are some fundamental differences in terms of across cultures, how important people feel their personal beliefs are or their personal meaning in life is in terms of their health and happiness. And so we didn't just ask in our research about spiritual health, because I agree there are some challenges with translation and meaning and the social implications of that question across countries and across languages. But even on questions of how important is it you are able to face difficulties with the help of your personal beliefs, or to what extent do you feel your life is meaningful? We do see differences across cultures where, Atsushi, to your point, the Japanese respondents are less likely to pick I find my life to be extremely meaningful, but they're also more likely to say that they find their life not at all meaningful. But yes, then the preponderance of people are more in the neutral or very meaningful category. And that's different from, say, India, China, Indonesia, where a third of people in India say, I find my life to be extremely meaningful. or about a quarter say it's important to me that I can use personal beliefs to face difficulties. So there are probably some underlying cultural attitudes or beliefs about the individual and how important my individual beliefs are with respect to navigating challenges in life.
Yeah, I can actually second to that, especially the fact that 10% of Japanese respondents said not at all in the question of to what extent do your personal beliefs give you strength to face difficulties. That's quite interesting. It is really a pessimistic type of answer. And of course, there are many interpretations I can probably give, but more like speculation. But it's true that it's underlying a belief and also social circumstances that may be affecting this trend as well.
Yes. And those are actually really interesting variables that we see. And we see that perception really changes across so many different variables and so many different factors. So it was really great to hear where those factors lay and like how it sort of changes. And so I think we've now come to the kind of like the so what of the podcast. Now that we've painted a picture of how certain demographics and certain people think about spiritual health, now my question is, what potential benefits might promoting spiritual health bring to the larger society as a whole, and perhaps bring to organizations in general? Jackie, maybe you would like to take this one.
I think we touched upon it a little bit already. The benefits by creating more awareness on this topic and actually finding ways to integrate it in a meaningful way in potentially at schools or in organizations are multifold. It's found that it helps people build resilience, the health benefits that we mentioned. In organizational settings, we see also engagement increases. I recently heard a researcher also say how it actually helps people learn 3 times faster if you do something meaningful and bring purpose into the context. Happiness as a link with happiness. And so recognizing the role of spiritual health can be very beneficial in the context of well-being, and simply asking yourselves, what ways do you find purpose in your life, or how are you helping others find meaning, can already start a very interesting, inspiring conversation. It can be implemented in different ways. And what I see in my field in organizational settings, that where it is done in a very positive and helpful way, is linking the purpose of your organization and the work that you do and the impact that you bring to society to the work that people do and employees do, is a great example of that. And it doesn't always need to be an organization in the humanitarian sector, or it doesn't need to be a public sector. It can be in any organization where you really think about sustainability and positive impact as an organization. And one demographic where we've seen that actually a lot of this benefit may be brought to is the younger generations that are still finding their place in society and struggling often with defining what meaning and purpose is. And we believe that there is a massive opportunity for learning environments, but also for onboarding programs in organizations when younger employees start a career, to actually bring this as part of their experience, as well as potentially job crafting, etc. So there are many ways to integrate it, and it starts with awareness and simply asking a couple of questions.
I would say it's interesting, to Jackie's point, I was a bit surprised when I look at our findings that younger people actually find that everyone thinks their physical and mental health is important. And actually globally, mental health ekes out physical health in importance. So about 85% of people think that their mental health is very or extremely important. And about 84% think that their physical health is very or extremely important. But for social health and spiritual health, they were rated less important by older respondents than by younger respondents. And for some reason, I had thought that older people would be more focused on those things, but actually it is very important to young people. But what's really compelling is that in Asia, holistic health seems to be more evenly divided. So in Asia, you see less of a drop off between the importance of social health and spiritual health relative to physical and mental. Whereas in Western countries, Europe, North America, you see more significant drop-offs, so that physical and mental health are very important. Social and spiritual health are somewhat important, but you'll see like sort of over 70% of people across the Asian countries that we surveyed with the exception, I think, as noted, of Japan, see their social and spiritual health almost as important as their physical and mental health. And so that tells me that for employers who are operating globally, that there are differences in what their employees expect, what they value in their health and what's offered to them, and then how they are finding meaning in their lives and how important their workplace and the purpose that they find there is in their sense of just general well-being.
Yeah, I agree. And also wanted to add actually 2 points. So one, I think we need to really think hard on why this research or literature in the past has not been focusing on spiritual health. So I think that our activity as an MHI to, of course, not solely define, but at least propose definition of it, then how to measure it, and also promoting that, the importance of this and advancing the knowledge around it. I think it's one thing that we can actually help also collaborate with academic institutions and others to really emphasize the importance of spiritual health in the holistic health concept. And the second, the health is becoming more complex as aging society and all the intervention that we've seen in the public health domain, that the physical health only accounts for a fraction of the entire health. And a lot of other measures, including social interventions and in spiritual intervention, actually becoming more important, especially when people get older with the multimobility. So I think the need of the population paying more attention to the spiritual health, and also even physicians and practitioners really consider spiritual health as a part of the holistic health interventions or improvement. And I think those are two things that we want to keep in mind, and also something that as a society we should move forward in the consideration.
Thank you all for this. Before we round off the episode, I just wanted to ask each of you this one question. So if there was one takeaway from this podcast, if there was a business leader listening in and they wanted to know how they should take their first steps to support spiritual health, what exactly would that be? Jackie, perhaps you want to take this on first?
It starts with yourself. Maybe ask yourself the question, what matters to you, what's meaningful to you, and be intentional about this. Maybe ask yourself that question now, and maybe asking yourself every morning, well, what's going to be meaningful for me today? What will I focus on?
One point that I would want business leaders to come away with is that while it seems the spiritual health might be something that is a very loose concept or doesn't have relevance to a business, there is a study done by one of my friends and our colleagues at Harvard University, which found that actually spirituality was linked with better health outcomes and patient care. And other studies that have found that people who felt like their spiritual needs were not met actually had much higher healthcare costs. And then this translates into people having actually better perceived health if they feel that their spiritual needs are being met. And so that means less time out of work. That means less absenteeism, less presenteeism, less turnover. And so for employers, there are real economic implications or business implications as well to keeping their employees as healthy and well as they can.
Excellent point. Atsushi?
Yeah, spiritual health is real. So any employer, business leaders really just believe that and that this notion. And then if you believe it, then you should take some actions. So hopefully this makes sense to the audience.
Thank you, Kana, Jackie, and Atsushi for your time, and our listeners for tuning into the McKinsey Future of Asia podcast. If you want to hear or read more about spiritual health or just health in general, please head to mckinsey.com/MHI for more McKinsey Health Institute insights. And we look forward to welcoming you to our next episode very soon.
You have been listening to the Future of Asia podcast by McKinsey & Company. To learn more about McKinsey, our people, our latest thinking, visit us at mckinsey.com/Future of Asia or find us on LinkedIn, Twitter, and Facebook.